Okay, when we're doing Sculptra on the neck, a lot of times what I will do is I'm going to numb my insertion points. So I will pick areas along the neck and I'll say, all right, we're gonna numb there, we're gonna numb here, and then we're going to numb here. And I'll just light with epi all my little spots so that way I can do what I need to do. If you're working on the chest, I've seen where people start here and I'm like, that's awkward. Then your hand's in between their boobs the whole time. So I don't like that placement. They don't either. So then I will just come lower on the chest. That way I can reach down into there and not be coming up and have my hands in between their boobs the whole time. But whatever you want. Totally no judgment here. Okay, so Sculptra in the neck. When I'm doing Sculptra in the neck, I hyperdilute it a lot. So we know that on the face, on label is 9. I'm usually doing more like 14, 16 in the neck, depending on the quality of their tissue. You're still giving them the whole vial, but now your chance of getting too much collagen stimulation in one area is lessened because it's now diluted and going over a whole area. That being said, I still think there's a few things that are very, very, very important to remember when you're treating globally a large area from one insertion point. One is, and I think we've talked about this before, your threads. That if this is your insertion point and you are working this entire area with a cannula, that if you continue to pull that product all the way back down to your insertion point every single time, you're going to end up with way too much product here. This is especially true with Sculptra because Sculptra is a water and it's always going to follow the path of least resistance. And so if you are pulling it down, it's going to come down and it's going to accumulate here. However, if you place that filler and you stop, but you still retract out your cannula to redirect, a little bit's going to come down here with just that process. Then you come back and you push, 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 stop, redirect. Push, 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 stop, redirect. I feel like you're gonna get a much more even distribution of that product. Also, even if it means doing additional threads in between here and placing less in each thread, you're gonna have a better result. Do not try to correct horizontal lines by placing larger amounts of volume in those lines. You are only going to end up with nodules. When you have thin skin, like in the neck, you have to be especially cautious. I can't tell you how many times I've seen from other providers where they're trying to get rid of those necklines with a biostimulatory agent, whether it be hyperdilute radius or Sculptra, and they are trying to volumize in those necklines, and I do not think that is the way to go. I think it truly is looking at more of a sprinkling effect than a volumizing effect. There's other ways to go about that I think are better. So my numbing points would be there, and then I'm just using that product. Whoops, I deleted it instead of drew. My approach is going to be just to fan this product, and like I said, I do not pull it all the way through, so I'm going to draw it backwards. So I get to this point, then I stop, 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 then I stop. Then here I may do like 1 or 2, and that's it, because that's really all it needs. And the same thing here, I'm gonna say, all right, you know what? I wanna come up here and do 1, and here and do 1, and here and do 1. And then I'm gonna do 1 here, and here, and here, and here, and you guys get the idea. I'm gonna do that across the entire neck area and making sure I'm getting all the way past that midline so that my product is treating on both sides. So I'm going to just fan it very, very small amounts across that entire area. Now, in all honesty, if you're doing the décolleté too, you're gonna have a hard time with one vial reaching or covering that much area. I was only able to get to this point with one vial. Her décolleté was a concern of hers, and so we're gonna address that at another time. But one vial I was able to treat this entire area with that same technique, just very, very small amounts. On her, I did dilute. I think it was a 16-to-1 or 15-to-1, I think is what I did. And I just flooded. I do use a little bit of lidocaine, so it was 14 mLs of saline. I use saline instead of water. You can use either. I use saline. I just feel like it's more like your body, and there's no problem with using saline, so I like to use that. I use bacteriostatic as well in this case. Also, if you aren't going to be doing the microneedling right away, you can just keep it. I mean, as long as you didn't re-inject or anything into that vial, it is clean. And if you have bacteriostatic, you can keep it for a month and then do it on another patient that, may be coming in or whatever. Small amounts. Do not try to bolus. Do not try to get rid of all these lines. Yes, these horizontal lines were a concern to her. Her biggest concern, though, was more the texture, the crepiness of the skin. If these lines were a concern, I'm going to go about this differently. We'll talk about that on the next one. But for just texture, I think Sculptra is beautiful. I think it works really well. I think you have to be very, very careful with your technique and your approach. But let's look at the end result. So, right afterwards, okay, going back to the Sculptra and microneedling, right after I was done, she went into microneedling. We had her go do the RF microneedling. So she came to me with numbing cream all over. I got this done quickly in about 10 minutes. We placed the numbing cream again, other than just the little insertion points, but she was numb because of the lido with epi. So everywhere else, we replaced it. She sat there for another 20, 30 minutes, went into RF microneedling right afterwards. And these results, I'm actually really, really excited about. This was 6 weeks later after one treatment, you guys. This does not happen normally. This is like multiple treatments. But look at the improvement in even the volume of those lines, that they are not as deep, that the texture's better. Like I said, we're going to work down in the chest next round, but that is a huge improvement from only 6 weeks out. We know that Sculptra really is getting its results at like 3 to 6 months, and this was 1.5 months in. So thrilled with these results. Excited to see as well what the RF microneedling, that collagen stimulation, continues to do, but from one treatment, phenomenal. Very, very excited. So look at perhaps doing multiple modalities in your treatment. Could you do regular microneedling? 100% yes. I like RF, the radiofrequency, because it has the technology to tighten the skin, which is what we're going after here. But if it's just collagen stimulation that you're working on, 100% you could. You would then actually microneedle, so you'd get your little bit of Sculptra that was left over, put some saline in there, and actually use that as your glide to microneedle. When you're doing radiofrequency, we apply post microneedling, so we will do the radiofrequency and then apply the product. But you could use it as a glide in traditional microneedling as well. So try it. Let me know what you think. I'm curious to see your results, and like, seriously, if you love it, tag me. I want to know. I want to see how you guys are liking things. So if you try my techniques, if you try different things that I'm teaching you, let me know how it's going for you and what questions you have. And I want to be excited. I want to be excited that this is helping you and that you guys are getting something out of this. So let me know.